to understand the role of evidence-based healthcare or evidence-informed healthcare, you have to look at the spaces where evidence is not there in terms of policy making or in terms of how the practitioners do their work. So when you see situations where our policymakers come up with decisions out of experience based on just values and interests, you also see a lot to do with growing inequities, waste of resources, failure to take into account strategies that could be very cost-effective, affordable for environments like ours in low-income settings that would potentially be very helpful for populations. So the opportunities and the advantages of using evidence in policymaking is very diverse, and one has to look and see what has not been done, which is quite a lot, and yet also the opportunities in there. I wouldn't say there is a specific magic bullet in engaging policymakers, but I would say one, they are human. Two, they have a social contract to improve services. But also, I would also start from one of the key impediments on how we approach. Usually, as researchers, we usually approach such engagements as from position of thinking we know more and not being humble that we probably know more from the research point of view, but not more from the social and the policy point of view, from which the policymakers are the experts, are the technocrats in that space. So one, being humble is very, very important when you're trying to engage with policymakers. But in saying that, I'm alluding to the point of building relationships, which is very, very important. Being able to engage at a human level, talking with them through probably the challenges that they have, getting to that point where they can trust you with issues, real issues that they are facing with in the policy space is what is important, and getting them in. Now, several approaches have been tried around that. You will hear things like co-creation, trying to get policymakers to own the process. Those are all very key ingredients, but all those do stir up in key facts that you need to be able to build this relationship, and it needs to be built on trust. It needs to be built on integrity, on ethics, on the credibility of the evidence that you're providing. The quality of the evidence is very, very important, and you certainly need to be humble when dealing with them, with the policymakers.